Hi, everybody, and very welcome to the 10th episode of our discussions, the Brain Function series from the Togetherness Media, Los Angeles, California. My name is Dr. Mohammad Nami. I'm the Director of the Brain, Cognition, and Behavior at the Department of Neuroscience at Shiraz University of Medical Sciences. And like ever, I feel so privileged for this platform to be sharing with you some important hints regarding another paradigms of diseases and also things that we're facing in terms of brain function and brain dysfunctions. And we've chosen this time to discuss and touch on a very important medical disease, a neurological disease condition, which is multiple sclerosis. And coincidentally, we came across the fact that 22nd of July, which is somehow like 10 days later, is going to be the World Brain Day, and that is dedicated to understanding better about the different dimensions of multiple sclerosis. And the slogan is Stop Multiple Sclerosis. So the fact of the matter is that when people hear about the diagnosis of multiple sclerosis, they really get upset. They feel hopeless. But we don't have to be hopeless. There's always a way, but the solution might not be right in front of us. We got to do whatever endeavor needed to find what works for each individual. And apparently that differs from person to person with regards to the treatment, the diagnosis, management of quality of life. And this quality of life is really a key parameter here. So like any other chronic disease, multiple sclerosis is a chronic disease. It doesn't necessarily have a definite magic bullet medication that we give to the patient and everything is boom, gone. No, it's not the case. In many instances, we got to be doing all the efforts to control and to help the patient control the disease and help the patient live a better life quality. And we know that the disease is causing a tremendous disability in many cases. Meanwhile, we need to know that what resolutions need to be there to help the patients to overcome those challenges and live a better life the way that they can. So in this discussion, I'm going to touch very briefly on the pathophysiological aspects of multiple sclerosis, and then we go for some discussions around disability and also the prevalence of the disease. I'll be talking with you about the education and access to treatment, how we're going to put together the efforts to do the advocacy. And we got to be the advocates for raising the awareness about multiple sclerosis and many other disease conditions in the neurological system worldwide. And that's the points that our discussions is going to revolve around. So apparently, multiple sclerosis, although it's a disease condition in neurology, but the base of the mechanistic basis of that disease and the underpinning of that disease is not only neurological. Many other system organs might be dysregulated, for example, the immune system. And the overactivity of the immune system for one side and the lack of the self-tolerance of the neural cells in the face of the immune cell would cause this conflict between the immune system and the neurons. So the immune system cells are going to kind of invade the body of the shaft of the neurons, that we have some insulation around it. So the insulation and the insulate around the axon, which is the shaft of the neuron, is called myelin. And the myelin is like a chef. But these immune cells are going to invade and attack this myelin, and the myelin is going to get disrupted, and accordingly, the transduction of the neural signals would get hampered. And that's why we're facing a wide variety of neurological symptoms ranging from sensory to motor to behavioral, cognitive, and emotional symptoms. People might have the disease, which is progressively getting worse day after day. Unfortunately, those are a fraction of the cases that they have primarily progressive course of the disease. But some other cases, fortunately, they have this relapsing remitting course of the disease, and many of the cases are that that sort of, class of multiple sclerosis. So sometimes they have a flare of the symptoms, they go to hospitals and they receive some medications. They have this problem with the eyesight, they have motor or sensory problem, they have the attack. When they get these steroids or other medications were prescribed, they will get better immediately. But by time, they might be having the experience of remissions. So in those remission, the patients will become symptom-free. That's the good news. They might become anyway secondary progressive in some instances, but we got to stop. We got to manage the course of the disease, and in some cases we can do that. But the treatment of multiple sclerosis is really multilateral. It's not like as a neurologist, a doctor is going to prescribe a disease-modifying medication, like an injection or a pill, and you take it like every week or every 2 weeks, and then you'll be fine. No, that's not the case. We are not supposed just to look at the disease. We got to be paying clear attention to the patient, not the disease. And a patient is like a holistic being. And we have different dimensions of the disease, ranging from cognition of behavioral symptoms and also motor sensory. They might be having some issues with the family support. They might be having symptoms of psychological health and so on and so forth. So we need to take a deep look at the problem from different perspectives. So here, let's discuss about the disability, number one. Multiple sclerosis, we know that is a debilitating neurological disease that impacts every aspect of the person's life, with effects ranging from cognitive impairments to significant physical and sensory disabilities. We know about that. So the problem here is that the disease is not a rare disease. It's a chronic but a prevalent disease at the same time. So the prevalence of the disease is quite high, as according to the latest research. And we know that almost 2.8 million people of all ages globally are affected by MS, and someone receives this life-altering diagnosis every 5 minutes globally. So that's really something which needs to be even more attended to as we're doing research, as we're doing the clinical care endeavors, because that's like a prevalent condition. So what shall we do? We're facing a sometimes debilitating disease and a prevalent disease, and we partly know about the underpinnings and the mechanisms for the disease. Some other things are still unknown. So what should be done? We need to educate ourselves. We need to educate the public. And education is a key, and we must work with the healthcare professionals to recognize the signs and symptoms of multiple sclerosis so people can be diagnosed early and effectively treated. And by that, when we treat the people, when we treat the patients in a timely manner, the course of the disease is going to be soothed, and the people will have the less risk to go down to repeated attacks or flare periods. So one of the key pillars here is the ability of the patients worldwide to have access to treatment. And unfortunately, this is not the case. We know that disease-modifying agents, though they slow the disease progression, and they dramatically improve the quality of life for those who are living with multiple sclerosis, yet access to these medications is unavailable in many parts of the world. So we got to be doing something for it, and we need to unite to help the governments, the policymakers, the societies, the media, whoever that we can access to. We need to just open the eyes of the public to the significance of access to treatment for these specific cases. Not only that, but us as academicians, as neuroscience researchers, we need to put our level best effort into the game to do even more research on different aspects of the disease and possible remedies, including or prevention modalities, including the vaccines or immunotherapy or targeted therapies or advanced state-of-the-art neurofunctional rehabilitative measures. These are our part, but the society part, the people part, I mean, the patient's part is that they got to know about their symptoms. they should not differ their symptoms and they just neglect their symptoms to up to a level that they have disability, they come to a doctor, and then when they are diagnosed with MS, everything is too late to be taken well care of. So all I'm saying is that let's go for the advocacy plans. Let's do something together. And no one knows it all. We just need to unite, and we can stop, we can modulate, and we can control MS by diagnosing the disease earlier and providing better access to life-changing treatments and advocating for improving the quality of life for those who are living with MS and their caregivers' quality of life as well. So hope we can do as much as we can. And let's do some awareness campaign activities on the World Brain Day this year, 22nd of July, 2021, on multiple sclerosis. Thank you very much for tuning in.